In today's topic, we are going to cover non-surgical rhinoplasty. This is an area of interest and everybody would like to know if they can change the shape of their nose non-surgically. And I'm going to talk about what is called as liquid rhinoplasty and what are the potential of what a non-surgical rhinoplasty can achieve. So non-surgical rhinoplasty could be with fillers, and you use synthetic fillers which are made of hyaluronic acid and you inject it under the skin on the nasal skeleton to give it more definition. So usually you can inject it here on the dorsum to make the dorsum look sharper. So if you've got a broad dorsum, if you layer it with a filler, then the filler will make it look narrower. So that's one thing that you can do. Of course, you can, when you place a filler from the side it looks like you've augmented the bridge. So if you've got a shallow bridge, you can place layers of the filler on the dorsum and increase the height or the projection of the bridge of the nose. Similarly, you can work on the tip and you can make the tip more projecting. You can make it appear narrower. You have to take note that this is only an appearance. You are camouflaging. You are not doing any structural change. You are placing the filler in such a way that it gives you an apparent feeling of narrowing or sharpening or augmentation. If you have a broad base of your nose, if this is very wide or you've got a wide alar base, that cannot be changed non-surgically. You have to undergo a surgical rhinoplasty to narrow the nose. But as I said, if you want to augment or make it look like it's a sharp nose or increase the tip projection a little bit, these things can be done with a synthetic filler. There are also threads which are used, and sometimes if you find that your tip is drooping, you can pass a thread and just anchor and lift up the tip. So that's a minimally invasive non-surgical option if you want to manipulate and bring the tip up. But apart from that, you cannot do much with the threads. But there may be so many other physicians out there who may be proposing various uses for the threads, but apart from just the volume that thread adds and the edema that it has for 3 to 6 weeks or up to 3 months, you may feel a little fullness from those threads, but it doesn't do much. So the threads which are used to anchor and lift are different from the cork threads. So you need to really consult a physician or aesthetic plastic surgeon to find out what are the options of non-surgical rhinoplasty and whether they will suit you. So here we would take your pictures, we'll morph them, we'll show you what is practically possible, and we will also show you patients who have had these things done and how they look. So it's very vital that you educate yourself properly before you consider anything. But yes, there is a distinct possibility of entertaining a non-surgical rhinoplasty, also called as a liquid rhinoplasty, if you are absolutely sure you do not want to undergo a surgery. But you have to keep in mind that fillers or liquid rhinoplasty, non-surgical rhinoplasty will have a shorter life, like fillers absorbed in a year's time, maximum a year and a half. But then after that, you're going to have a touch-up done. So keep that in mind. That's the difference between the non-surgical and the surgical. But if you want a quick fix, you've got some function coming up and you want to have quicker recovery, then yes, a filler or a non-surgical rhinoplasty would settle down in 2 to 3 weeks time. So I hope you've liked this video. If you liked it, please subscribe and don't hesitate to share. Thank you very much.